Now back to our coverage of coronavirus here in Connecticut. Doctors are concerned about people possibly having strokes and being afraid to get checked out at the hospital. Channel 3's Kara Sunland found out why you should not wait and need the help. Immediately call 911.
I'm joined by Dr. Amre Nouh. He is the director of the Comprehensive Stroke Center at Hartford Hospital. Thank you so much for being with us.
Oh, thank you for having me. It's a pleasure.
We always hear that when it comes to stroke, time is brain. So what do you want people to know about hospital safety? Because some might be fearful to go quickly to the hospital with COVID-19.
Yeah, it is so important to understand that a stroke is a life-changing event. It is life-threatening, and the risks of not getting the appropriate treatment are just detrimental. So if somebody is experiencing a stroke, they should call 911 and go to the nearest hospital.
Okay. And what about patients who already have a stroke history? Are they more susceptible to getting COVID or having complications?
Not everybody, but if somebody has a stroke, that means that they have some risk factors that would put them at a high risk of having another event in the future.
So what have you really seen over the past few months as far as patient volume with the pandemic?
Yeah, I think what we've observed here in our system, as well as in states across the Northeast, during the pandemic, we've seen the presentation to the hospital for patients with strokes, especially mild or moderate strokes, have went down. I would say that there's a lot of literature coming out on this, roughly about 40% or so reduction in patients coming in a timely fashion to the ER or coming at all.
So just remind folks at home, it's a good opportunity for those listening. What are some of the symptoms you'd be most concerned about that you say if it were your friends or family, you would call 911?
Absolutely. We always talk about fast. I'm going to add something to that called B-FAST, B-E. So B for balance, any sudden balance issues that might arise, inability to walk or veering to one side, eye loss of vision in one or both eyes or inability to see on one side or paralysis of the eye movements. And F is for face, drooping of the face or weakness of the face and asymmetric smile. A would be for arm strength. Ask someone to lift their arms up, and if they're weak on one side or they're drifting, that's a sign. S is for speech. That could be the quality of the speech. That could be the inability to speak at all, or just the production of speech itself. And T is time. Time is brain. So anytime you have any of those symptoms, be fast. Call 911 right away.
Absolutely. I know you guys can do a lot of good as long as people get there in time. Thank you so much, Dr. Nouh, for being with us.
Thank you for having me.